What's up, everybody? I'm David Warren, and welcome back to my channel. In this week's video, I want to talk to you about, is it still worth it in 2022 to become a nurse practitioner? And that's something that I think is very relevant and something that I really want to delve into today. If you are new here, check out my other videos and consider subscribing. Give this video a thumbs up. I'm a nurse practitioner and I've been an NP for about 7 years now. I have my master's degree and I'm certified as a family, acute care, and emergency nurse practitioner. My original NP program was family and acute care, and I'm dual certified. I went back and tested as an emergency nurse practitioner and passed that certification as well. As you can surmise, all of my experience has been in emergency medicine. That's really all I've ever done. However, if you've seen my other videos recently, as of a few weeks ago, I am an SRNA, so a student registered nurse anesthetist, and I'm in anesthesia school. I'm making a bit of a career change, and that's a whole nother topic for a whole nother video. Right now, I really want to focus on, is it still worth it to become a nurse practitioner? Because truth be told, I'm a nurse practitioner, so I feel like I'm in a really good place to answer this right now. I don't think it's in a good place for people who aren't nurse practitioners to really answer that question, but I've kind of been on both sides of it now as far as CRNA and NP, and I really want to talk about that today. Is it still worth it, 2022, to become a nurse practitioner? If you have seen my other videos, you know that I do a video pretty much every year talking about this. Is it worth it in 2019? Is it worth it in 2020? I don't think I did a 2020 one, but you get my point. Is it still worth it to become a nurse practitioner? I think that really depends on a lot of different factors, but I want to start off just naming some random things that I think play a particular role in whether or not it's still worth it to become a nurse practitioner. The first of which is, it really depends on your school. It really depends on the school that you go to. And what I mean by that is, there are kind of two contrasting schools of thought. There's the online programs and the brick and mortar programs. And there's this big divide as to which is better, which you should go to, etc. I will start out by saying this. I don't think there's any harm in online programs if they are structured properly and if they are run properly. And what I mean by that is, there are a lot of programs that are brick and mortar that offer online components to their program. And I'm kind of talking before COVID, because during COVID, it's kind of hard to do that because a lot of stuff transitioned online that wouldn't normally be online. CRNA programs are a prime example. They're normally not online. However, a portion of my program has transitioned online. I still have to go on campus, but we have Zoom meetings and it's transitioned online due to COVID. And medical schools are the same way. A lot of that is transitioned online. I think now that we're, a couple years in, everything's starting to transition back, but you see my point. Some things that weren't originally online had transitioned to online. I think we're kind of making that switch back now. But I think there are, like I said, two different schools of thought, online versus brick and mortar. I don't necessarily think one is better than the other. I really think it depends on the program and what is being taught and how it is being taught. I will say that in my practice as a nurse practitioner, I've precepted nurse practitioner students who have been from reputable schools that have an online program. And some of them have been extremely well prepared, ready to go. They know their stuff. And some of them don't. Some of them don't know really anything. And contrasting that with, I've also precepted some students that are from like a no-name online university, and they came very well prepared and were able to talk about pathophysiology and physical assessment and everything that comes with being a student in the clinical setting. And I think there are good and bad from both sides of it. There are good programs that are online that will prepare you well, and there are bad programs that are online and that will prepare you very poorly. And there are good brick and mortar schools, and there are probably bad brick and mortar schools. I think it really depends on what you put into it and what you get out of your education. I think if you go to a low recommended, low on the totem pole online university, you can probably expect to get out what you put into it, meaning that you may not get a whole lot out if you're not putting a whole lot in. I think the same can probably be said of brick and mortar schools. But again, I think there's also something to be said that you probably will get a better education out of a more reputable school. And I think that's the point I'm going to stick with, is you will probably get a better education out of a more reputable school. I went to a reputable school and I got a great education. I can't really speak to the poor online schooling programs. Like I said, I know some people who've gone through some of those types of programs. Some people have turned out okay, and some people have not. Some people have struggled with passing boards. So I think it boils down to the type of schooling you choose. Go to a reputable program, and it really depends on how you learn. If you are more of an online learner, then maybe that might be your cup of tea. If you're more of a brick and mortar type of learner, then that might be your cup of tea. However, on the negative side of that, I think there is a lot to be said about the NP education system as a whole. And that's going to be another video for another day. I'm not going to go on that tangent right now, but I think a lot can be said about the NP education system. And whether or not you choose a good or a low reputable school can oftentimes determine whether or not you're going to get a job as a new graduate nurse practitioner. And that's really kind of the point that I'm driving to with the school thing, is if you're an experienced nurse practitioner and you went to this low man on the totem pole school, low reputation, you get a job, you have years of experience, and you are clinically sound and can make good decisions, and you're a good clinician, you're probably not going to have trouble finding a job. You could. I'll come back to that. But if you're a new graduate and you graduated from, Central California Community College for the nurse practitioner, and, nobody's ever heard of this, you're the first class that's ever graduated, you might have trouble finding a job, depending on where you go. And so I think the school really plays an important role right when you get out of school, because if you don't already have a job lined up, which I think you should, we'll get into that too. There's so many points I want to get into. I'm not going to try to jump ahead here. I think that your job potential really hinges on what school you go to if you don't have connections or odds and ends to try to weasel your way into getting a job. I think your schooling plays an important role in that. If you go interview somewhere and they know you come from a reputable university that educates their students well, and they come out well prepared, and they've hired nurse practitioners before from said institution, and they've always been good, then they're probably going to go with you. But if you come from a no-name school, nobody's ever heard of it, they don't know you, they don't know anything, they're probably going to pass on you. So I would say go to a reputable school, because it could ultimately depend on whether or not you get a job. So that's somewhat important. The next thing I want to talk about is pay. So pay is definitely something to be talked about. Is it still worth it to become a nurse practitioner? I am currently in Central California. Pay for the average family nurse practitioner with a few years of experience out here is about $120,000 to $130,000 a year, from what I can see. And that's in just like a general family practice type area. I don't know this area. I haven't worked here. I've only been here like a few weeks. I don't work here right now, so I don't really know the odds and ends of emergency medicine or all the specialties and what they pay. However, when I was in Dallas, Texas, that's a hopping area for online nurse practitioner programs. You can apply, start the next day, get your schooling done, and come out with a degree and still probably have trouble finding a job. So I think the pay there is significantly lower than what it would be in other places in the United States. So in Dallas, Texas, as a new graduate nurse practitioner, you can expect to make $30 to $40 an hour, $50 an hour max. That translates into $70,000 to $90,000 a year as a new graduate nurse practitioner. I'm on several social media sites that post this sort of thing. So again, I started as a new grad in Dallas 7 years ago, and the field was completely different. But nowadays, you can expect to make $30 to $50 an hour as a new graduate nurse practitioner. When the travel nurses are making $7,000 a week. So you see where you're going to make your money at. That's a whole other topic as well. We're not going to try to get into that. Okay, so pay. It really depends on where you go, honestly. So if you go to a big metropolitan area that's saturated, you're probably going to make less. If you go to rural America, Alaska, Idaho, Washington State, and the eastern side, in the high desert, somewhere like that, you're probably going to make a little more. Typically, you are going to make more the more suburban, rural area type area you go, you're going to make a little more money. If you go to the urban metropolitan areas, you're probably not going to make a whole lot of money as a new graduate, and you probably will have trouble finding a job. Which leads me into my next point, the job market. So we talked about schooling, we talked about pay, let's talk about the job market. The job market is extremely challenging. And I think that is a huge factor that you need to consider. If you're thinking about becoming a nurse practitioner, if you're in nurse practitioner school, you really need to hear this point. It is extremely challenging to find a job as a nurse practitioner in most settings. Okay, now that I'm in California, I've just looked around at jobs out here. There are jobs posted. However, they stay posted for maybe a day and then they're gone. And then you don't see a whole lot more. And, a week later, you'll see another job pop up. So it's not like the jobs are just like, driving in and looking for people all the time. It's definitely jobs are fewer and far between than probably they have been in the past. And the same goes with the market in Texas. I'm a little more familiar with that market. It's extremely challenging to find a job in Dallas, Fort Worth. That is very hard. People have waited 1 to 2 years post-graduation to find a job in that region as a new graduate nurse practitioner. So I think all of that to say, the job market differs wherever you go. Okay, it's not going to be the same here in Central California as it is in Seattle, Washington, as it is in Maryland, as it is in Denver. You get it? It's just going to be different wherever you choose to go. And so I would say before you ever apply, because most nurse practitioner programs are going to be right around 2 years, get on Google, get on Indeed, somewhere, and try to find out where you're at. If you're kind of stuck in a particular area, if you're stuck in Denver, look in the Denver job market and see, is it even feasible for me to go to nurse practitioner school and expect to get a job coming out or jobs open? And the second part of that is be ready to move after you graduate school to find a job. I would not guarantee going to school and finding a job where you're at. I would say you have to be willing to move for the job if you want to be a nurse practitioner, because that's the nature of the market right now. And that also comes with oversaturation. And I know there are some of you who don't really like that term, but I think it is an accurate term to describe some of what's going on here. And I think the oversaturation really has to do with a bunch of different components. It has to do with the online programs that, again, are churning out people that you can apply to no-name universities, get your F&P, and be done in 9 months. It applies to the pay. The more you turn out, the less pay will be, the more pay will go down, and the harder it will be to come by a job. And that is kind of currently what we are experiencing now. That's kind of where we're at. So if you want to be a nurse practitioner, I would say look at a school, go to a good, reputable school, especially if you want to try to land a job immediately out of your education program. Look at pay, find out, the area you want to go to, what are they paying? What can I expect to make? Is it feasible for me to make like a livable wage? Or can I, travel as an RN and make $6,000-$7,000 a week and put off the NP thing for a little while? And then also I would look at the job market. So is it even feasible for me to expect to get a job, in wherever I'm at, in Denver, in Seattle? Look at the potential job market and see, is it even feasible for me to get a job there? If not, and you still want to do it, be willing to move, be willing to relocate to a different part of the country, be willing to go somewhere to get that job. Now, I want to bring us out of the new graduate area and kind of into several years of experience. What does that look like? Like for someone like me who has 7 years of experience, can I go wherever I want and get a job? And unfortunately, the answer is no. No, that's not how it works. It's a funny story. For this video, I wanted to see what would it look like if I sent in some applications out here, just test the water, see if I could get a job. I'm in CRNA school, I'm not going to work, but just to see, is it even possible? So I applied to 4 different positions in Central California, all kind of in this general area within probably an hour and a half of everywhere. Didn't hear back from anybody. They all sent me rejection letters saying that they received, multiple applicants and, I was turned down. And, that might say a lot about me. Maybe I'm just don't have good experience. Who knows? But I sent in a bunch of applications, didn't get a one. So I wouldn't have taken it anyway. If they interviewed, I would decline anyway, because I'm not really interested in working right now just because I'm in anesthesia school. But you get my point. I just wanted to test the waters just to see what it's like. It is extremely challenging to find a nurse practitioner job in Central California. It is in Dallas, Texas as well. I don't know where I'm going to be next, but maybe wherever I am next, I'll do a video and let you know what the job market for nurse practitioners looks like. Now, on to some of the other medical side of being a nurse practitioner. Is it still worth it? You're going to be doing different things as a nurse practitioner. And the way I can describe it is it's a higher level of thinking with more responsibility and less pay. It's kind of the best way to describe it. Higher responsibility, higher thinking, less pay. Doesn't really make sense, but here we are. So the good thing is you can really make a difference in the lives of your patients. You can make tangible differences. And this obviously depends on the areas you're working in. If you're working in family medicine, treating blood pressure and cholesterol, you are making differences in patients' lives. It may not be a tangible difference, but, are you preventing them from having an MI in 15 years by putting them on blood pressure medicine and treating their cholesterol? You are. You can look at it that way. If you work in emergency medicine and, somebody comes in coding and you successfully resuscitate them, send them to the ICU, and they don't leave a turnip a few weeks later, then you've obviously saved their life. So you've made a tangible difference. So I really think it just depends on the area you're working in, but you will make differences in the lives of patients, more so than you will as a bedside nurse. And what I mean by that is, as a nurse practitioner, you're going to be the one calling the shots. You're going to be the one writing the orders, designing a treatment plan, implementing interventions. You see what I'm saying? Ordering diagnostic tests. You're going to be the one with a pad or with a clicker on your mouse on your computer, putting in orders, doing things. And so that's going to be my camera's falling down. That's going to be one of the differences there, is you will make a difference in the lives of patients, but it's going to be a little bit different. And kind of further talking about that, you also are going to have different roles. So you're not going to be as hands-on as you are as a bedside nurse. So you're not going to be the one in there, 12 hours every shift dealing with a patient. You're going to go to a patient's room, depending on, again, where you work. I'm speaking emergency medicine here because that's my background. You'll go into a room, see the patient, do a quick physical exam, get some orders going, go on to the next patient, go on to the next, do the same thing over and over. Then you'll go back and review lab tests and review imaging and discharge some patients and admit some patients. And so you're going to be less hands-on than you would be if you were the bedside nurse, but you're going to be seeing a higher volume of patients than you would be if you were a bedside nurse as well. So it's a different role. And I think the biggest thing you can do to experience that is shadow a nurse practitioner. Go spend some time with a nurse practitioner in whatever area you want to work in. If you want to work in the ICU as a nurse practitioner, go find somebody that does that. If you want to work family medicine, go find somebody that does that. You see my point. Go shadow somebody to make sure that's what you want to do. And that's the thing I find that a lot of people don't do, is they just assume, I want to be a nurse practitioner. That's the next step. That's not the next step. Get on my soapbox here. It's not the next step. Shadow somebody and really determine, is this what you want to do? Because you're going to be doing this for the rest of your life, and you're going to be making less money than you are as a nurse. So find out, is it what you want to do? Because to work longer hours, to have more responsibility, to make less money, you're really going to need to have like a passion inside of you that's going to ignite and want to do that for the rest of your career. And if you can't do that, then don't be a nurse practitioner. That's kind of the word of advice that I have for you here. Shadow. All right. So that's my little soapbox on, is it worth it to become a nurse practitioner in 2022? Comment below. Tell me what you think. I want to hear your opinion. Is it worth it to become a nurse practitioner in 2022? If you're a student nurse practitioner, comment below. Tell me your reasons for why you did it. If you're experienced, tell me your reasons. Do you think, that's who I'm interested in hearing from. Do you think it's worth it? If you are a nurse practitioner, tell me below, is it worth it to become a nurse practitioner? Thanks for watching. See you next time.